Hi, good afternoon. I'm Katrina, one of the nurses at RMA. So I'm on the helping with IVF medication teaching today, and I'm here with.
Hi, I'm Morgan. I'm a data analyst with the research team here.
And today we're gonna go over some medications, see it live. Definitely helps with any like videos you've been watching, but this will help show you step by step. And Morgan's gonna learn how to do it.
Yes, I don't know how to do it, so Katrina's gonna help me too.
So we have 3 medications we're gonna go with today. One of them is Follistim medication, the other is Menopur, and then Ganirelix. So usually most cycles are starting with Follistim and Menopur. So those are like the ones we'll start off with.
Okay.
And then down the road we'll add in Ganirelix is usually in the protocol, but we'll go over that one too. So we'll start with Follistim. So normally you get like a full box with this pen on its own. And if you open up the zipper container, you'll see like a set pen that's ready to get some medications. So basically it comes apart. So we can I'll give that to you and you can try untwisting it. And then you'll get a bunch of medication that you'll probably have in your fridge because this one does stay refrigerated. So this is your Follistim cartridge. So you'll take off the top, perfect, and then you'll unscrew that part. And we're basically just slipping on this little cartridge that sits right on top of this stick. So
how do I put it in? This way?
So we're gonna go like right like
this. I see.
Yeah.
Okay.
So now you can put the yellow cap back on. And then that's set for your medication. And usually this is lasting you like a couple of days, like 3 to 6 days. So once you have it set, you're not really switching it too much. They also give you a bunch of needles inside of the package. So you'll be able to just peel off that little sticker. And then that pointy part is like a little needle inside. You're just gonna put that on top and screw slowly. Perfect. Until it's snug. You don't want to go too tight because sometimes that can get like stuck on.
Okay.
So that's perfect. So this medication has a little dial on the end. So you're basically going to turn your dose to around 150 units is going to be your dose.
And it just clicks?
Yeah.
Okay.
You're going to 150.
Got it.
Perfect. So this medication goes, I recommend the belly. You can do it in your like thigh as well. But for today, we're going to do the belly.
Okay.
So it's basically around like 4 fingers away from your belly button. So right here, we have a little injection spot. So basically you're going to be pinching and then your needle can basically go directly.
Okay. So does this just, nice. So I pop it off.
Pop it off. And then you're going to take this one off and you'll see the needle below. Perfect.
Got it.
So you can, after we've cleansed with like a alcohol swab, you're pinching the area and you can go as slow as you want to inject the needle. You'll put the full needle in and press the plunger and that will go all the way in. This one's just the dummy one.
Okay.
Perfect. So the needle, this will go all the way down and then it should go back to 0.
Got it.
That's how you know you've done the
Great. And then how do I dispose of this?
So then you're going to recap
with the big cap.
Big cap.
Got it.
And then once that's placed on, you can unscrew the top of the cap for this part here.
Oh, sorry.
Yeah.
Oh, it's supposed to bring the other top with it.
Yeah, perfect.
Okay.
Amazing.
Got it.
So that one will just go
so then this would just be disposed
into your sharps container.
Got it.
Yeah. So you can just place that
right
here.
Okay.
And then that one we can just put back in the fridge. It stays there till your next injection. So you just recap it.
That one's nice because it has the
dial.
The dial so I could see how much dosage. Is nice.
And if you miss the dose ever, you can like wind it all the way to the very top and then it will kind of reset.
Oh, okay.
Yeah, because I've done that before.
Yeah.
Like you miss the dose and then you just kind of
and then everything goes back in the fridge.
Yeah. So you can just place that in. You can chuck this container that it came with, but then keep your green one in the fridge. So that's your Follistim. The other one that we're gonna do, you might have seen in the videos if you've ever watched them, is your Menopur. So that one comes with a small little needle, 27 gauge, a 3 cc syringe with a long needle that we're actually going to get rid of because I like to use the Q cap just to make life easier.
Okay.
So your dose today, when you get your instructions, usually will say 2 powder vials. So you're going to take out 2 of these guys.
Okay.
And then 1 liquid vial.
Okay.
And basically you're going to be mixing 1 milliliter of the liquid, put that into the first
Got it.
powder. Then you can actually transfer that to your second powder to get it all into 1 injection.
Okay.
And then you'd only have to do 1 Menopur injection.
Okay, great.
So
So what do I do first?
You'll take the cap off this one.
Does it just come
And
off?
just like you can flick it off.
Oh,
Perfect.
nice. Okay.
And then you're basically going to take your long needle. You can take that, unscrew that long needle off because we don't need to use it. There's an option to use it, but they do give you Q caps. So
Okay, that's easier.
So for the Q cap, it has a little peel off. You take that off. And then there's kind of like a little Lego piece. You can snap that right on top of the the vial of saline.
Okay, and should I be cleaning the top of this before?
This one you
Or I guess it has
don't
a cap
have
on
to.
it.
Yeah, it's only if
Okay.
you're reusing any of the medications, but let's snap that on. Perfect.
Great.
Now, what I like to do is draw up 1 of air, or you can draw it up ahead of time.
Oh, I see.
Yeah.
So 1, whoops, of air.
And then you can attach that onto the top of the
Okay, and it just
cap.
twists.
And you'll just press the air into the vial.
Got it.
And then you can press it down. Actually, what I do, push all the way down and then flip over the whole vial. Perfect. And then you can let the fluid fall into the syringe so that you have about 1 milliliter. Yep. Now you can kind of play with the syringe to go up and down to be able to draw.
In case I go too much.
Yeah,
or
and
go
you
too
can
little.
sometimes you'll see in the videos about air bubbles. It's really
Yeah.
so you don't have like a large air
Got
bubble. So
it.
you'll just draw down to 1.
Okay.
Perfect. Amazing. So you can basically we'll flip it over. You can untwist or pull off I'll just show you. Just
Okay.
because
Okay,
snap
got
on.
it.
Yeah.
So just snap it off.
Yeah.
The
Amazing.
sodium
Yeah.
chloride.
So we're done with that one.
Great.
Now we're going to take our first powder vial. You can just take off the cap and then that can go right on top of that Menopur vial. And you can do this on the table, whatever is
Yeah, might be a
easier.
Might be a little easier on the
Yeah.
table.
And now you
Okay.
can press all the liquid into the powder.
Great.
Right? And now you can keep it pressed down and flip it over and just like gravity allow you to pull it all the way down.
Okay. To when?
So we'll
Typically.
just take basically everything out, but it should be
Got
about 1 milliliter.
Oh, perfect.
Yeah.
Okay.
So now we're done with that one. You can actually take the Q cap off this vial.
Like upside down?
You can do that. Yeah. You can kind of find what works for you. Whatever is easiest. Perfect. And then we'll take our second powder and do the same thing. This is the medication that does sting a little, so just a heads up.
Okay.
All right, so we can put that
So it's normal if it stings and burns for a little bit.
when you do the injection.
Okay.
Yeah.
So we put this one on.
And then you can do the same thing.
So it goes all the way in.
Amazing. And then flip it
Flip.
over.
And then let it come back out
Yeah.
to like 1.
Yeah. And if you have like air bubbles ever, you can like play with.
Got it. Okay.
Yeah.
So it doesn't have to be exact
The
right
little
away.
air bubbles, you're okay.
Okay,
So you
great.
can take that off. And actually you can unscrew the syringe from the Q cap because we're done with
Oh,
both of those.
okay. Got it. So the medication's in here now.
Yeah. Now we take out the little tiny needle for actual injection and that can just twist right on top. Perfect. So now you're ready to do your injection. Same type of thing. You can do it, say it's on the same side, that's
Mhm.
fine, or you can separate whichever is preference. Just know it does have a little bit of stinging sensation.
Okay, how long would that last?
Like 30 seconds to a minute.
Okay. Okay,
And
so-
then you can always like ice the area before
Okay,
and after.
cool. So I'll clean this.
Yeah.
And then,
And the same thing, you can do pinch and then go straight in with the needle. Perfect. And then you'd be having a stinging sensation, but luckily for you, you have the.
I'm saying, okay. And then just dispose of that how
In the
as
sharps.
it is.
Yeah.
Got it.
Yeah, you did great. That's
Oh,
usually the
great.
hardest one.
I know that
So the fact that you had no problems, you got the Q cap off.
It's nice that you can, adjust it
Yeah.
if you go too little or too much, so
Yeah.
it's less stress.
Yeah,
I
you're
feel
like,
like
I
than
can
if I
play it.
accidentally like mess it up.
Yeah, then you're
Okay.
like, okay, I can.
So
put
that was the
bucket.
Menopur.
Yeah, so
Got
those
it.
are usually done like one in the, like Boston in the morning.
Got
one
it.
here in the evening.
Cool.
If there's any questions, let's see. My partner found. Okay, so my partner found Menopur to cause the most discomfort of any of the meds. I think this is because of the volume of fluid, but also possibly because of the concentration. Any tips? So that's what, I was saying, you can ice the area like 5 minutes before, 5 minutes after. It's definitely, if you're using the 1 milliliter, it's going to be, a lot better. Then you don't have to use 2 milliliters, but definitely causes the stinging sensation, or at least like 30 seconds to a minute after.
Okay.
So the ice usually helps. You can cut it down a bit. I would just stick with the 2 milliliters or the 2 vials of Menopur in the 1 milliliter and keep with that amount, because sometimes if you're, increasing it down the road, we're up to 3 powders. So that amount of fluid, kind of the concentration brings that amount down a bit. For 3, yeah, I would stick with still one milliliter for even anytime your Menopur dose is increasing.
Okay.
You just stick with the 1 ml. And then, I would try the ice and hopefully that helps, but I know they haven't found a way to make the medication without the stinging. But.
So after I inject these medications, can I move on with my daily life? Can I go work out?
Yeah, I would say like you shouldn't have any side effects right off the bat. Sometimes you have headaches, that sort of thing right off the bat, but then down the road you might get some more bloating, cramping.
Okay.
So we just say like no high impact exercise.
Got it.
So if you want to go for a walk or like lightweight, that's okay.
Good to know.
Yeah.
Awesome.
Yeah, but the same day, like you can take it with or without food, doesn't matter. You
Oh
can
yeah. Okay.
work it into your schedule because it's usually about 10 days of injections.
Okay.
All right, perfect. So we will move on to the Ganirelix medication, which is nice because it's already pre-filled.
Perfect. That's easy.
So you should get a couple of these boxes for your cycle. You'll do one of these, in the evening with your Menopur usually. So you'll just do one pre-filled syringe a night.
Okay. And is this medication in the fridge?
This one is not
Okay.
with this brand, so you can just keep that on the counter.
Great.
And it basically has all the medication inside. I don't necessarily recommend to get rid of the air bubble, only because sometimes pushing the plunger, I've heard, where the medication ends up on the ceiling.
So it doesn't
it's okay.
really matter.
Yeah.
Okay.
Just so that you don't lose your medication.
Got it.
It has a little cap on top that you're basically going to take away from you. And then that way you don't poke yourself. Perfect. And then that's ready to go. And you're going to be doing the same thing. You're going to pinch, clean, and inject. Okay, you're a pro now.
Yes.
All done.
And then dispose of this.
Yeah.
Okay. That one's easy.
This one is easy. Doesn't have any stinging sensation. But sometimes you can get a little red mark around the area that you do the injection. So if you notice that, it sometimes lasts for like maybe half an hour.
Okay.
Only if it's spread to something larger on your stomach.
Yeah, that was going to be my question. When should I
If
be
it's like
worried.
larger than a quarter, that's usually like unusual,
Okay.
so you can
Okay,
always.
but a little redness and irritation is
Yeah,
normal.
usually gone
Okay.
by the next day, sometimes it's a little bit itchy, but it usually just resolves on its own. You can also ice the area to help too.
Okay.
But yeah, that's how the Ganirelix is just gonna help, make sure all the eggs grow at the same time, usually is when we're adding it in, so that's nice because it's already pre-filled, so.
And you may have already said this, but where do you recommend injecting these medications?
I recommend the belly only because it's easier to pinch.
Than the thigh or, okay.
Yeah, only because, you can see it if you're doing the injections on your own.
And can I switch sides?
Yeah, and you
Okay.
can alternate. So
It's like one side sore.
Yeah, and I usually say like belly button level or lower.
Okay.
Is better, and then staying like 4 fingers away from the belly button. But yeah, you can alternate. If you were getting, super sore on the belly and wanted to move to the thigh, you could do that.
Okay,
Yeah.
Great.
Yeah, you just have to kind of pinch, get it to stick up a bit. But yeah, so let's see if we have any other questions. I'm trying to think.
So you said I can eat and drink normally. Can I drink alcohol with these medications, or is it recommended that I don't?
It's recommended to not, but if you needed to, like you had an event or something, you can always have a glass of wine and then you just want to stay really hydrated after.
Okay, just make sure I stay hydrated.
Yeah.
Got it.
You can still go dancing, stuff like that. And coffee's fine, like a cup of coffee.
Oh, yeah.
So you can stick with your Starbucks.
Okay, perfect.
Yeah, so you're trying to make this into your like day-to-day schedule. So you need to like move around the times a bit for your injections.
And should they be done at the same time each day?
You can fluctuate. So like say you wanted to like go for dinner and then at night, you got home later and anytime between like 6 to 10 p.m.
Okay,
Yeah.
Perfect.
Same with the morning injections. You wake up a little bit later on the weekend.
Yeah.
You can do those injections a little bit later.
Sounds good. Not to
Yeah.
be too stressed about it.
I know. Life is going on around the cycle too. What would you recommend doing if I have to travel sometime during this or is not advised? You can work that out with your nurse or coordinator. It's better to be here during the time frame only because after the first couple of days of injections, we're coming in every other day. I do have patients who monitor outside and go to, find a clinic that they're able to monitor, but it sometimes can add that extra stress. So if you can avoid kind of doing any like longer travel, if it's one day you need to be out of town, we usually can work around that, but it's better to less stress in the cycle, just to make life easier, but it's definitely possible to, monitor if you had a weekend away or, we've definitely done outside monitoring everywhere.
Yeah, and then if I'm traveling, I guess when I'm bringing like the Menopur, I just have to make sure that it stays.
You can bring like a little lunch bag, keep all the meds
stays
in.
chilled.
Yeah, you want to bring meds even that you might be using in the future.
Okay, just in case I have everything.
Yeah,
got it.
Yeah,
if I have to travel.
Yeah, if your dose needs to change, but
Okay.
I know there's like weddings that are happening, things like that. So some things are set, but you can usually work around with like your nurse or coordinator to be like, these are my out of town dates, and they can give suggestions too. But yeah, I'm trying to think what else you might come across.
Can work out. I can take it at the same time around.
Yeah.
It can fluctuate.
Yeah. And then usually these are like there's different protocols, but you're kind of using these 3 medications throughout your cycle, and then you're ready for the trigger. And then that's always like 2 days later for your retrieval.
Yeah, retrieval 2 days later.
Yeah, so you always get a little bit of a heads up of when that date might be.
Got it. And then do all of these medications have like similar side effects? I think you mentioned headaches.
Yeah.
Usually. So that's normal.
Yeah, that's what I find in the first couple of days of starting the medication is headaches, maybe. Sometimes you can get like the bloating, cramping, sometimes hot flashes, but they're usually all pretty similar. And it's just like slowly increasing your estrogen level. So it's not too much right off the bat.
Got
so you
it.
can still like go to work, like have your day to
Okay,
day. Just
perfect.
know like might be a little bit more tired
Yeah.
when you get closer
Okay.
to the retrieval.
Mhm.
So that's usually what we see.
Okay.
Yeah. Yeah, but
Sounds good.
hopefully this was helpful.
I
for
know
you.
it is. It's way going through it. It's a little less stressful than just reading all the information.
And especially
sure.
there's usually like a big box of medication that gets delivered, and that's very overwhelming.
Yeah.
But once you break it down into like what you need for the
Mm-hmm.
next couple of days, we go day to day, and then you're coming in every other day to get, updates on your cycle and questions. So
Great.
But yeah, that's a little intro into Menopur, Ganirelix, and Follistim.
Thank you, Katrina.
You're welcome.